I want to start with you, Ms. Waldfogel. I was curious, are you familiar with the two-generation approach to reducing intergenerational poverty?
Yes.
What are your thoughts on its role in potentially taking those federal policies that already exist, taking aside the need for additional policies, but better coordinating those to support the development of families and an emergence from that cycle of poverty?
I think, well, as you probably know, it's a model that's attracting a lot of interest. There's a very successful program underway in Tulsa, Oklahoma, directed by one of my colleagues, Jean Brooks Gunn, and her colleague, Lindsay Chase Lansdale. I mean, it's a win-win. So they're taking proven early childhood education programs, which really help engage parents, and they're matching those and tying them to employment and training programs for the parents, and not just random, generic employment and training, but in the healthcare sector, or, sectors where there's really a demand. We know from research that when parents are involved in education and training, their children do better in school and they do better in preschool. And likewise, obviously, children are going to do better in preschool if their parents are stably employed or in training and have more stable resources. I think we don't do enough of that. We don't do enough of thinking across programs, and it's a really promising model.
Well, I appreciate your comments on that. I know that in New Mexico, we've seen groups like United Way and others that have really tried to pull these pieces together and act as a coordinator to support the family as a whole, have some very positive outcomes. And we've seen that in both liberal and conservative states and very different, politically different governments have real success with this approach. And it's certainly, it's something I've introduced legislation on and continue to hope to push. One of the other challenges that we have in my state, and I think this is becoming an issue all across the country, is that in New Mexico, more than 10% of children are actually being raised by grandparents. And historically, extended families have been an incredibly important part of our culture and represent a significant asset to all of our communities. But what should we be looking at within the federal government and states to make sure that as we're supporting families, we're not just thinking about mothers and fathers, especially in those cases where another family member is actually the direct child care provider to those kids?
It's a really important question. I mean, the statistics that I was reciting about, only 60% of workers having access to the FMLA, only 40% of workers having some employer-paid family leave, only 15% have access to federal child care subsidies, even though they're low-income and eligible. That pertains to parents who are entitled to these programs. Grandparents are often boxed out entirely. Exactly. So there's a lottery to get these things in the first place, but the grandparents aren't even in the lottery because they're categorically ruled out. So it's just heartbreaking because you hear these grandparents who have chosen to take on or had to take on these grandchildren and yet aren't able to get access to the programs. Yeah, we really need to clean it up. Under the FMLA and the various state paid family leave laws, there's a lot of variation in who counts as family, and there's a lot of debate about who counts as family. But for sure, we ought to be including grandparents, and they ought to be entitled.
We should be tying those benefits to the child rather, as so long as they have a legitimate caregiver.
Absolutely, and it same thing with the EITC, with the child tax credit.
Exactly right.
Yeah.
Many of these people are literally well into their retirement years and have fixed incomes and yet have all of the incredible burdens of trying to not only raise a child, but then after that, also help them through their education.
Yeah.
Ms. Rowe-Finkbeiner, I wanted to ask you a little bit about if you could expand some on how paid family leave impacts the presence of fathers and other caregivers in the life of a child and what impacts then come from that.
Access to paid family medical leave is a win-win-win-win for families, our business, and our economies. It's one of those true policies that just makes you want to clap and give it a standing ovation, because we see that when families have access to paid family leave, that actually, if dads take the paid family leave as well, then we see those wage gaps between women and men and between moms and dads go down. And when we have pay parity, if women had pay parity, then 50% of children would be brought out of poverty, our GDP would be increased by 3%, and we'd add more than $500 billion into our economy. So making sure that dads also have time with children actually helps moms rise. And so it's very important. When we look at some of the other countries, and we did note that most other countries have some form of paid family leave, except the United States of America, and when we look at those countries, we see that some have found that having dads have access to paid family leave is so beneficial for the whole economy, because again, when women have money to spend and are making the majority of our consumer purchasing decisions in an economy where 72% of our GDP is based on consumer purchasing decisions, then we all do better. But if we have this wage gap with moms and it's significant, then we do worse overall. So these countries, some of the other ones who've had paid family medical leave in place for longer, actually often offer a bonus package. If the dad takes leave, then the family overall would get an additional amount of paid family medical leave because they found that it boosts the economy so much. So other things about this win-win of this policy, and again, I love this policy, is that we see that businesses are actually helped out with retention, productivity, and they have lower retraining costs. We also see that taxpayers are helped out. In some states like California, where they've had paid family medical leave for longer than others, we can see that there's a 40% lower need for SNAP and TANF because people have that bridge moment of having those costs come in as childcare costs more than college, infant childcare costs extraordinarily high. So having that access to paid family leave at that crucial time when a new baby arrives is very important. But not to mention what you also brought up, which is the sandwich generation. We need paid family medical leave, and we need it for all workers. And we need grandparents to be able to take it, as well as parents and other family members.
So in comparing in places that have instituted paid family leave, medical leave, and those who have not, there have been consistent data trends showing an actual increase in economic productivity.
Yeah, and actually, Dr. Waldfogel did the original research, which I think I found many years ago, and much to my delight, when I first found out about the mom wage gap, which is huge. Moms are making 71 cents to a dad's dollar, and moms of color, due to structural racism, are experiencing increased wage hits, with Latina moms making as low as 46 cents to a man's dollar. It's
With effectively the same resume, right?
With the same resume. And we can talk about those studies, because I love those studies, of 2 pieces of paper. And there are 2 pieces of paper, 1 resume. The only difference is that they're a mom and the other that they're a non-mom. This was a study done by Dr. Shelley Carell, and she found that they're 80% less likely to be hired if you're a mom, and you're offered $11,000 lower starting salary, whereas dads get a wage boost. So getting rid of this wage hit when we have so many moms being primary breadwinners is so important to our families and our economy.
And does that wage gap persist even after mothers return to work?
Yes. The wage gap persists forever. And so there's policies like the Paycheck Fairness Act, which we also need to pass. And what that does, one of the important things that does is you can't use prior salary history to create current salary earnings, so that your compounded wage hits that you've experienced over time don't determine your future salary history. But one of the things that Dr. Waldfogel found, and I do want to bring this to her because she is brilliant at this and many other things, is that there's no single silver bullet solution. We need paid family medical leave, we need affordable, accessible childcare, and we need sick days, and we need access to affordable health care. So families are crunched. We have a modern workforce, and our public policies are stuck in a time that maybe never existed. And so we need to bring up our workplace protections, our floor for workplace protections, and then we'll see those wage gaps narrow, and then we all win.
You might say there's no silver bullet, but there may be silver buckshot.
Yeah, exactly. And we can do it. I mean, in the past, in the United States of America, we've passed packages for many things that have many different solutions together. We can pass packages and independently pass these laws to make the changes that we need. It's long overdue.
I want to thank you all for your testimony. We're going to take a really quick recess here for about 10 minutes while the chairman returns so I can go vote as well. Thank you.
Thank you.